Speaker, after 5 years, this government's record on women's health care continues to lag behind other provinces. They have refused to make birth control free. They have kept women waiting years for endometriosis diagnosis and care. They have refused to provide at-home HPV screening tests and phase out invasive pap smears. They have refused to expand midwifery care with fewer than 20 midwives practicing and no service at all in Cape Breton. And they have refused appropriate cancer screening options for women with dense breasts. Yesterday, the minister said she wasn't going to do a women's health strategy yet. What is she waiting for?
I recognize the Honourable Minister of Health. Well, I was going to say wealth. I'm sorry, Honourable Minister. Health and Wellness.
Thank you. And as I've said in a number of times in the past, we were in a very, very deep hole when we formed government in 2021. We have invested heavily not only in the system itself, but in the people that work there. And while there is a particular women's health strategy on the table, we're not in a position right now that we're able to do that. But there are a number of things we have accomplished. Like, there is more primary care in this province. 94% of people in this province are attached to a primary care provider. That is essential care that will prevent people from having their conditions worsen and have to go seek specialty care outside of their communities. We've spent incredible amounts of money in the EHS system to make sure that people have timely access to emergency care. There's a number of other opportunities that I'll have to share in the next question.
Order. I recognize the Honourable Leader of the Official Opposition.
Madam Speaker, what the government is hearing from the opposition today is maybe they should plan first and then spend. The IWK Foundation has been calling for a women's health strategy so that experts can determine how best to care for women and gender-diverse Nova Scotians and what resources are required, and then they can put them into practice. This government has spent billions of dollars on health care, and yet women's health care needs are still definitively not being met. Does the minister understand that spending first and planning second might be a backwards approach?
I recognize the Honourable Minister of Health and Wellness.
What I understand is that I'm the health minister for every single Nova Scotian in this province, regardless of gender, regardless of race, regardless of any defining characteristic. And when we formed government, we had to ensure that there were services across this province for every Nova Scotian. We heard that people wanted access to primary care. We have delivered on that. We heard that surgical wait lists were out of control. This is the lowest surgical wait list since 2015. We heard about EHS, and there were extended wait times. We've improved that. We've expanded bed capacity in Nova Scotia Health. We've looked at different models of care. Of course there's more to do. There will always be more to do. But fundamentally, the foundations of healthcare are markedly improved, and we will continue to work across this province to deliver care in Nova Scotia.